Welcome back to our Conversations on the Couch series. I'm Lindsay Morton, and today I'm joined by Dr. Mark Bloomston, a surgical oncologist, who's talking to us today about stomach cancer. This is something a lot of people may not be very familiar with. So when we talk about stomach cancer, what are some of the symptoms that patients may experience?
You know, stomach cancer is a tough one because people don't realize how big of an organ the stomach is. It's a fairly large organ inside our abdomen. Right. So it's an organ inside of here that can stretch. And so we have the capacity to eat and stretch our stomachs, but when people start noticing that maybe they're not stretching the way they used to, they're getting full a little easier, weight loss is a big one. Sometimes people could present with bleeding, and it all kind of depends upon where the tumor is located within the stomach and how big it is.
Gotcha. So if they are diagnosed with having stomach cancer, are there treatment options available to them?
Well, the key to treatment is surgery. We do want to remove the tumor. Sometimes that involves removing the entire stomach. So people's initial reaction was, how in the world am I ever going to eat again if you're going to take out my stomach? Well, it's pretty amazing because patients, not only are they able to eat again, then they pretty much get back to normal eating. Probably maybe it takes a year after surgery, but it's pretty impressive that they can make a full 100% recovery, go back to eating normally, having a normal life.
So this may be a silly question, but where does the food go?
So we use the intestine to kind of create a new stomach. Our stomachs do have a role in our digestion, but really the main thing it does is act like a reservoir when we eat, and then slowly deposit the food bit by bit into the intestine. Well, we use the intestine now to become the new stomach, if you will. So we lose a little bit of that capacity. So you get full easy, you lose weight early on after the surgery, kind of same thing that they're used to already from their presentation, but it doesn't really impact the digestion. We absorb our nutrients in our intestines when that's all still normally intact. So they really go back to eating normal.
Interesting. And we can do this treatment here locally. They don't have to travel.
We do. We do these operations quite frequently, actually, amazingly so. Pretty high volume. We probably do this operation a couple times a month.
Well, Dr. Bloomston, thank you so much for joining us today, and thank you all for tuning in. We'll see you next time for Conversations on the Couch.